Now, the first podcast was a couple weeks ago, and it was all about grief and loss and missing out as it relates to the pandemic. Today's podcast, also mental health in the time of COVID, is going to be focusing on fear and anxiety. And I'm so happy to have my wonderful colleague, Beth McDonald, here with me today again. And we are producing a series of podcasts, and we will announce more at the end about the future podcasts that are coming. But today our focus is going to be on fear and anxiety. And feel free at any point to type in a question if you have one, okay? Now, for those of you who are new to our podcast, I want to take a moment so that Beth and I can introduce ourselves and give ourselves a little bit of background about who we are and why we're here with you today. Beth, would you like to go first?
Sure. Thanks, Sylvia. I am Beth McDonald. I'm an intuitive and an astrologer. I've been in practice for 30 years. I specialize in business, legal, political, crisis management kind of situations. That's my wheelhouse. And my primary demographic is higher educated working professional women between about 25 and 65. And the main thing I do is help them navigate life's moments with greater confidence and peace. And part of that has to do with peak performance, making sure your insides are as beautiful as your outsides. And that's where I met Sobel, and we work together to help people be the absolute best they can and really emanate their soul's core, no matter what's going on around them in the world. And because COVID has made things so much more complicated, Sobel and I have been working a lot more closely together to try and help people navigate this.
Great. Wonderful, Beth. Thank you so much. Wow. And Beth and I have been collaborating, well, for the last 30 years. Now, I've been a holistic chiropractor for 35 years now. And when I say holistic chiropractor, a holistic chiropractor does more than just adjust the spine. We also tend to the nutritional well-being of our patients, and we also tend to the emotional well-being of our patients. And I was very, very fortunate right out of school in 1986, 87. I was trained in a process of emotional healing, and it had to do with how do you help people find where in their bodies they're holding on to stored memories of trauma, what we now refer to as PTSD. And so that was a real great gift to me in my practice, that I was able to help people not only physically with their bodies from the standpoint of being adjusted chiropractically and getting good nutrition and lifestyle, but also to help clear out stored emotional trauma. And so for the past 35 years, that's what I've been up to. And in the last couple of years, especially with the pandemic, I have figured out a way to bring that emotional healing work. It's called emotional clearing to a wider audience by creating guided emotional clearing programs that I have available online. And we'll talk more about that later. But right now, I want to jump in and just say that it's always a pleasure to have conversation with Beth. We do have a lot of conversations, and we decided people would want to hear these conversations because we have so much to offer, so much wisdom that we've garnered over the last 30, 35 years. And we have helped a lot of people together to, as Beth was saying, find that calm and peacefulness within themselves so that it matches, you know, who they are on all levels. And you can get out there and be who you want to be in the world in a powerful way. And some of us who are over 65 also get help from Beth. So don't let that 25 to 65 stop you.
Just guidelines, just general guidelines. Yeah.
All right, everyone. So we're ready to get started on the topic of fear and anxiety. And the very first thing that Beth and I wanted to share with you today is how powerfully fear and anxiety can affect our health and our physiology and our well-being. So whether your fear and anxiety is something that comes and goes, like you have episodes of it, or whether it's there all the time and it's chronic or recurrent, these emotions are very, very powerful in terms of how they change the chemistry and the physiology of the body. Now, many of you have probably heard the expression fight or flight. So when something happens that's really threatening or dangerous, your body reacts and prepares to do battle or to run. And in a healthy body and in a healthy world, those stresses and those dangers would happen, and then they would be over. And so literally the stress or the danger would happen, your body would respond to it, the stress or danger would resolve, and your body would go back to normal. The problem in our modern world, and especially in the last couple of years during the pandemic, is that the stresses and the dangers have been ongoing and unrelenting, which means that our body's fight or flight system has been on all the time. As we say, those of us who love to drive, pedal to the metal. So it really is as if the foot on the gas pedal has been on for a long period of time. Now we know with a car, that's going to burn up your fuel and your car's going to die. But with your body, what happens is that fight or flight system starts to get depleted, specifically the adrenal glands. And one of the things that happens is your body loses its ability to fight normal inflammation. And so what happens is people's bodies become chronically inflamed. And what we now understand, and what natural health people have understood for many, many years, is that chronic inflammation is at the root of almost all degenerative illness. So is fear and anxiety important to deal with and address? Absolutely, whether the short term or the long term. And not only does it create that chronic inflammation, but it depresses the immune system. We're in a pandemic. We're having to deal with how do we keep our immune systems healthy enough to deal with a dangerous virus. So there you go. That's the down and dirty about how fear and anxiety on one level can affect our physiology. And I know, Beth, we were talking the other day about the nervous system and some of the more, the central nervous system, some of the changes that take place. And I would love you to share what you were sharing with me the other day for our listeners.
Absolutely. I've had the great good fortune to work with a lot of really smart women. And one of them in my practice is a neurobiologist. And she explained it to me in a couple of ways years ago that have really stuck with me and enabled and empowered me to help other people in a more sophisticated way. But the first thing she used to talk about was how post-traumatic stress disorder is not just for veterans. It's anything that's traumatic, a traumatic birth, a traumatic car crash, a traumatic incident with a roommate, And then for women, most of us get PTSD at some point by the time we're 25 years old, because of some sort of sexual inappropriateness that we endure or experience, or sexual violation. And so for women, emotional clearing is going to be a lot more important just because there are so many more ways we're violated. And then the other piece that she was really emphatic about, and that kind of changed my life and my thinking, has to do with just the different parts of your brain and how the limbic system plays a critical role in PTSD, and the fight or flight response. And when you are exposed a lot to a lot of traumatic events, the hippocampus, which is the part of the limbic system that is responsible for regulating the fight or flight response, it just gets jammed open. It's like an open throttle, and then it's open all the time. And so one of the things you want to, when you are ready to address your fear and anxiety on the physical level in a more sophisticated way, or if you want to just take it to the next level, clearing what's going on with the PTSD that you have will help soothe that hippocampus and shut that throttle back down so it can function more normally moving forward. It's massive. Right. And that's what Sobel's brilliant.
Thanks, sweetheart. And of course, again, when you're in a dangerous situation, you need to be ready to do battle. Everything, every muscle, every blood vessel, every chemical needs to be aligned to do battle. But to have that kind of hypervigilance, that battle readiness all the time, is what creates the drain on the system and what depletes the immune system and depletes the body's ability to function normally. And as you say, if that hippocampus gets stuck in that that open mode, then and you can't return to normal, then over time, it's more and more depletion and more of that strain on your body and your ability to stay healthy. I think it's really good to say just a little bit about the term PTSD. We use it probably fairly commonly now because it's started to become a mainstream phrase and understanding. PTSD stands for post-traumatic stress disorder, and basically, and most of us did hear it in terms of relating to war veterans. They used to call it battle fatigue or
shell shock.
Shell shock. Yeah. But now we give it the name PTSD. But one of the amazing things that has happened during this pandemic is that a lot of people have woken up and recognized in themselves that they are also carrying some, stored emotional trauma, that they also have PTSD. Now, what's interesting is when you think about a war situation, there's everything you can think about in a war situation in and of itself can be traumatic, can be frightening, can be terrifying, can be life, endanger your life. But when you think about veterans coming home, some of them manage to come back and resume normal life, and some of them don't. So the ones who don't, who then get labeled with chronic PTSD, what I learned back in my early days of learning about emotional healing work was that the war experience actually triggered older memories that their nervous system was already holding on to from early in their life, things that had happened that were traumatic that their body was storing. And then the war situation was on top of that, it reinforced those early childhood traumas. And those were the people coming home who were having a hard time re-entering normal life. So in very, very basic terms, our bodies do hold on to the memory of emotional trauma. It gets stored in our nervous system. And that is the basis of PTSD. It's that the body is actually holding on to those memories, and it sits there like little buttons waiting to be triggered. So, and that's where emotional clearing work comes in. That's where we seek to find where in your body and your nervous system those stored traumas are held, and then get them to release. So, my teachers, my brilliant teachers who taught me that 35 years ago, what a gift. And here we are all these years later. And finally, we can say PTSD, we can talk about emotional trauma, we can talk about the body remembering trauma. And it's an okay conversation to have in the mainstream now because people finally are more and more aware of it. And I think the pandemic has really alerted people to the fact that it's maybe about them too, not just about a war veteran.
Yeah. I'm really finding that I'm really finding a parallel to that in the virus and the pandemic. It's like, just like going to war will trigger whatever your early childhood issues were. I'm seeing a lot of people getting triggered by the virus, by the lockdowns, by the political furor and polarization. And I think, in Buddhism, there's a blessing in everything. And I think the blessing of this pandemic is that it gives us permission to go more inward, to live in a more inward way, to remember what our core values are, to live from that place, and then to double down, to recommit to staying on a healing path and to address whatever it is that's coming up in a more timely, sometimes even deeper, more significant, more meaningful way. Right. It's given us permission. It's funny. I just traveled to the Midwest, and like these kinds of conversations are not just California things anymore. Yes. It's becoming a lot more mainstream, and thank God for that.
Right. So even so, the California virus being too voodoo or weird, it's spreading to the middle of the country.
The healing, the mental health aspect that the virus is helping forcing us to face used to be a California thing, and now it's a little more mainstream. And
I know we're finally getting a little respect. Can I go?
Yeah.
Anyway, I want to talk. Thank you, Beth, for that, and I want to talk a little bit about the difference between anxiety and fear coming up either as an episode, a moment in time, or the idea of it being chronic or recurrent. So when patients come to me and they say, I'm dealing with fear, I'm dealing with anxiety, I ask them that question. Is it there all the time? Even if it's at a low level? Is it like the tone, your emotional tone? And I have had people say to me, yeah, I'm actually, when I really think about it, I'm a little afraid all the time. And often when I'll ask them, do you have an awareness of what you're afraid of? And many of them will say, no, it's just a feeling of anxiety and fear. It's there all the time. And it applies to everything I can think of. Sometimes, some people will say, it's like I'm always expecting the axe to fall or the worst to happen. And some people have that experience of having in their life, having had traumas occur at a time in their life when everything was going really well, right? And they may have had that happen 3 or 4 times. And now it's like they're always living in the expectation that something bad's about to happen. Uh-oh, my life's going really well. What's going to happen next? Or a lot of my patients have told me about parents, either one parent or both parents, who were incredibly, would have very sudden mood changes that were completely unpredictable. And many times those parents would become dangerous and abusive.
Right.
And so for those people, they're carrying a constant fear and anxiety that is tied to change. So anything that changes for them feels dangerous. From the outside, someone might say, "What do you mean you're afraid of change? Don't be a sissy." But for some people, they are literally carrying the memories that when things change suddenly, they're in danger.
Right.
And so we want to get more and more clear with ourselves, more and more aware with ourselves of, number one, are we afraid? Are we anxious? Is that part of our emotional tone? And is it there all the time, or does it just come and go?
Right.
If something happened and now you're afraid or anxious and then it goes away, is it in episodes, or is it a chronic long-term pattern, which of course is going to be more sensible on the physiology?
Right.
What's your experience on that level with your clients?
Well, there's 2 things come to mind, and one of them is, again, that intersection of where your practice and my practice fit so well together like gears, is that one of the things we see a lot is that very dynamic you spoke of, where something's going well in my earlier life and then something bad happens, is one of the most frequent blocks we find to success. I can get somebody the best marketing plan, the best business plan ever, but if they're unconsciously or subconsciously terrified that if they succeed, something bad's going to happen, then it doesn't matter. They're not going to be able to push through and either do the plan we make, execute the strategy we make, or get the results we're asking for it. And that was one of the things that really, when we started noticing that with our mutual clients, that was when we realized it's like, oh, we've got a team here. We can help people. This is fantastic.
Yeah, it's really been amazing to watch people really come through so many limitations and restrictions, so many blockages. In chiropractic, we were taught the body heals itself. In a normal situation, the body will always heal itself. It's always striving to heal itself.
It strives. It certainly strives. Yeah.
That's what homeostasis is. The body is always attempting to try to find health and balance. But when something is blocking it from happening, then it really interferes with that whole process of being healthy, whether it's emotionally healthy or physically healthy. And, in chiropractic, we were taught, if your neck is out of alignment or your low back is out of alignment, those are blockages in the nervous system. But what I didn't learn until I got out of school was that emotional stress and trauma also creates blockages. And sometimes, as we've talked about with PTSD now, those blockages are sitting in the nervous system. They are preventing people from achieving their goals that you so beautifully set for them in their business plan and their marketing plan. And one of the ways it shows up, and we've talked about this and helped so many people with this, is stored emotional trauma over time can create negative, limiting, mistaken belief systems. So you set yourself your beautiful marketing plan and your goals, and you're ready to go for it. And you get close to that success, and then boom, you hit some kind of a stored negative belief system, and now you so-called self-sabotage, meaning that all of a sudden things crash and burn again, even though your best intentions were to move forward. So
And
yeah,
all your conscious effort.
absolutely.
Yeah.
So let's get into talking more and more about the pandemic itself and how it's contributed to fear and anxiety. You and I were talking the other day about people who have already had victimization in their life in some level. Could you share what you were saying about that?
Yes, this is one of the things I'm seeing so much. And in hindsight, it's absolutely logical, but it really tends to bowl me over a little bit. And this gets back to the PTSD. Whatever mental health issues we had going on before the pandemic are exponentially more up and needing of attention and breaking through to our consciousness since the pandemic, and especially since the war. And it's kind of gone in phases. Like I noticed a big leap in it when the pandemic first hit, and then it kind of calmed down a bit when the vaccine was on the horizon and people thought, oh good, there's a chance we can live a little more normally. And then as soon as we got the vaccine going, Omicron showed up and there was this other surge, and then there was the freak out again. And now it's settling down, but now we've got this war in Europe. And then also, you know, we've reduced a lot of the mandates around social distancing and vaccinations and masks and stuff, and the numbers are coming back up predictably. And so there's kind of, for people who are already struggling with certain issues and especially fears of change, the last 2 years have been brutally hard, and the future can look a little grim. And that's part of where the emotional clearing then becomes so important, because you don't want to be slipping into that helplessness, hopelessness thing. You know, there's always help, there's always hope. You just sometimes have to walk where angels fear to tread. You know, the thing that comes to mind is that famous Joseph Campbell quote about how the gift that you seek lies in the cave you fear to enter. Like, you have to go into the darker parts of your shadow, and so the shining star that's your greatest gift can come out and be more readily accessible.
Right. I think the opportunity for healing actually across the globe is greater now than it's ever. Number one, because this pandemic has really brought, people have gone inward. Some people have been on their own. Even if you were with family or not completely on your own, there's been more and more opportunity to go inward and to become more aware of your own issues, and to start to recognize that it's probably not only okay, but essential to get some help. And, you know, when people are, I mean, you think about if we could like paint an ideal picture, the ideal way to be in the world would be to feel healthy and grounded and safe and content, and have healthy boundaries around yourself as a concept. And then as the circumstances happen around you, you recognize them, you deal with them, your body deals with them, the fight and flight, in a healthy way, and then you come back to center. But this pandemic has thrown even really healthy people off their center, and people who are already having a hard time staying grounded are, you know, more and more in trouble because of the number of things that have changed, the intensity and the speed.
And the speed.
Time to adapt, you know, and the whole notion of, you know, what is stress? Stress is something your body has to adapt to in a general way. That's a very simple term for stress. And a lot of people have been focusing on how do I manage my stress? But managing stress is just that, it's managing it. But if you really, and that can be good and it can be helpful, not knocking and managing stress at all. But there are deeper ways to help yourself and really get into, you know, where are those blockages in your energy field? How do you get them released and be free of them, so that you can become, you know, more and more grounded, and then able to sway with the changing times. And it doesn't mean you'll never get upset about, never be stressed out again, never have any problems. But it's something to shoot for. It's something to reach for. And, certainly that's been our goal together with our clients,
Right.
help them find that
Right.
thing and that place where circumstances, with money, that's always a great one. People relate to that one a lot. When you have money in the bank, fine. When you don't have money in the bank, terror, panic, self-judgment, shame. But
Yeah.
ideally, if you had money in the bank or not, and you were really grounded within yourself and not reacting to the circumstance, then you're in a much better position to say, okay, there's no money in the bank. Okay, what do I need to do? I need to make a phone call. I need to get a quick loan. I need to do more work. I need to take a nap, whatever. You know what I'm saying? Circumstances happen all around you, but you have more and more power when you're not blocked by these old traumas to make choices that are healthy for you. And this, being triggered in fear and anxiety, what could be more terrifying than being in a state of fear all the time? And what could be less grounding than being in a state of fear all the time?
Yeah.
So.
The thing that I'm also very grateful for is that different ways of recognizing when you're upset, when you're in a prolonged state of fear and anxiety, and linking that to more self-destructive behavior is more mainstream now. And I'm so happy about that. And I want to validate all of you out there who have developed a greater sense of consciousness about emotions and behavior, and for the way we throw around terms with humor now, like Karening. It's like if you're having a meltdown in public about something, you're having a Karen moment, you're Karening, and you need some help. That's how public scenes are not a sign of mental health. And so I'm seeing a lot of people joking about, oh my gosh, I almost Karened at Costco. I need to go see Sobel. It's that kind of thing. Right. Or also the talk about COVID weight, gaining weight during this lockdown. I have a client who always talks about eating her feelings. She comes home and she eats her feelings, and so just the level of awareness, like we've got slang terms now for self-destructive behavior that are so much more mainstream than they've ever been. And we can laugh about it when we catch ourselves doing it. And I'm so grateful for that.
Right. And you and I were talking, we had a little list going about some of the symptoms that could be.
Yeah.
You were talking about self-medicating with drugs, alcohol,
food, sex, gambling. Yeah.
Any addictive behavior.
Cleaning, compulsive cleaning. Yeah. Any OCD, any obsessive compulsive behavior technically is kind of an attempt to self-soothe. Right. And that's an indicator. If you find yourself, like, we're all going to do it a couple of times a week over something, but if it's a way of being, right, if it's your primary coping method, then it's time to maybe take a deeper look at that. Now is going to be a really good time. Now is a really good time.
And it's a great time to reach for help. And also because of COVID and because of this greater awareness, there is more help available. And there are more avenues for help. And so I think that's really important. I wanted to go back to some of you and I had come up with some about the different ways that people are afraid and anxious during COVID. And we had made a kind of a list of things we'd like to just mention to people. People are afraid of getting sick, afraid of dying. They're feeling fear for loved ones getting sick and dying. And the other big one that you and I were talking about is people being afraid of how other people's actions or choices might affect them. And that one is huge. So much charge on it. I have a hard time even thinking about that one. It worries me, that whole, because I find where do we find the balance between taking care of ourselves, being responsible for taking care of ourselves, and taking care of each other? And I think there's people have gotten so afraid of other people. Right. And I'm not saying that there isn't reality to that. There is reality to that. If you've been at an event where you've been exposed to the virus and then you come home to an elderly parent and now your elderly parent gets sick, that's real. That's very real. And it does happen. And there's two pieces to this.
For people who have PTSD already from being victimized, whether it was a sexual assault or a car wreck or an abusive parent or something like that, it doesn't matter. But if you already struggle with a history of victimization, then it's going to be very difficult to stay upright and grounded and centered and calm, where you could potentially be victimized by someone who's not willing or able to follow rules or, you know, be more civic minded. So then the other piece to that, I'm seeing people who have been victimized are very conscientious about victimizing someone else, especially when they've got an elderly parent either at home or in a nursing home, when they've got someone in the family who's undergoing chemotherapy or different kinds of cancer treatments, if they've got people in the family who are immunocompromised or diabetic or obese, any of those high risk factors that make their outcomes, should they get the virus, less positive. And so it's hard to make really good decisions in real time when you're restimulated and afraid of being victimized or concurrently afraid of victimizing other people. And that's the thing I see probably the most right now, especially in women, especially in women who have family members in that category, especially around parents, you know, because we always lose them too soon, you know, and then it's like, oh my gosh, you know, I don't want to be the one to kill mom, you know. Literally, I've had people say that. I don't want to be responsible for my mother's death, you know, and it's very real. It's very real.
It's very real.
Yeah.
Exactly. And then there's, you know, this is an interesting piece of the fear and anxiety picture here. People have become afraid to get into conversation with each other.
Oh, yeah.
I see that a lot. And I've noticed that in myself as well, where I'll stop and I'll think before opening a conversation, because I realize that on a given topic, I have a very sort of deep and complex point of view about something. And it would take an hour for me to really lay it out for someone and say, yeah, well, here's how I feel about this. And I'm not pro this and anti that. I'm somewhere in the middle. And there's that fear and anxiety about, oh, if I open my mouth and I start this conversation, boom, I'm going to get judged. I'm going to get rejected, or I'm going to lose a friendship.
Right.
Over an opinion. I had a friend ask me a question the other day, and I really didn't want to get into it because she was sort of asking me what I thought somebody else, like other practitioners like me, might think.
Right.
And I kept trying to not answer the question, and finally I thought, okay, she really wants to know. And I said, I can't really speak for another person, but I can say this is what might be going on. But I realized as soon as I started the conversation, I wanted to backpedal, because I could tell that things that I was saying was upsetting
to her.
Because it wasn't a big enough picture, though. I didn't have time to lay out the whole context and say, okay, let's sit down and talk. In fact, can I have a blackboard and some, you know,
and about 30 minutes.
And about 30 minutes. And then I can give you my point of view. And with it, because I have a point of view that ranges, it includes a lot of ways of thinking. It's very complex. And no one ever accused me of being simple, right? That might make life easier, but I don't think at this point it's going to happen. So I have a lot of complexity in my understanding, not only from living a long time and being a very naturally curious person, but also I've been a natural medicine doctor for almost 40 years.
A long time.
So I have some points of view that include a lot of information that other people might not have access to. So that fear and that anxiety around conversation, around friendships, important relationships, that one's been very real. I mean, that's one I've personally experienced.
I just want to second that, because I'm seeing the same thing, and we've talked about this. All of us have lost people in the last 2 years. Our social circles, our familial circles our attachments have become fewer because there are fewer people on the planet now. There are more dead people than there used to be. And so the relationships that remain are very important, and we don't want to blow it. However, we often haven't been educated about how to communicate effectively across the polar divides that we have. And for those of us who have been educated, if we're emotional, if we're not grounded, if we're in the middle of a PTSD response or an anxiety attack, all that stuff we know just goes right out the window. Right. And so there is an extraordinary amount of anxiety, and we've cross-referred people for this very thing, where either it's a politician or someone in a leadership role in the community or a leadership role in the family or the head of a company or teachers. It's so very important when you realize that your emotions are getting in the way of you having calm, rational adult conversations with other humans. Then it's time to call Sobel. It's just time, because it doesn't have to be that way. And humanity is depending on us learning these things to move forward. If we can't communicate across our divisions, nothing's going to get better. We have to learn how to collaborate and compromise again.
Exactly. And you and I have this conversation many times about how everything we do as individuals and in our collaborations and in all of our collaborations, we are really looking for things that bring people together.
Yeah.
You know, I want to, everything I do and everything I believe in is all about healing and bringing people together, which means that, you know, we need to get over that fear, conquer that fear and anxiety about communicating with each other. And if you are someone who's suffering from PTSD or is carrying these emotional triggers that get pushed, when you're in that state, you can't communicate. Well, you can, but it's going to be a fight. It's going to be an argument. In my relationship program, I have a program called Healthy, Happy Relationships. It's a 3-part emotional clearing program. And I say to people, if you're in a partnership or friendship, any kind of relationship where you are now educated enough about your own, about yourself to recognize when you're triggered or to recognize when the person that you're talking to is triggered, then the best thing you can do is lovingly and respectfully try to step out of that conversation and just say, look, I recognize that, you know, I'm really upset right now. I'm feeling really triggered right now. And I do want to continue this conversation, but if it's okay with you, respectfully, I'd like to step away and go take a walk and calm down, and let's come back to this.
Go back around.
Work. But what it does, you know, again, it's awareness. Number one, I'm triggered. I'm aware that this is bringing up terrible fear and anxiety or whatever it's bringing up. And I am in the middle of my trigger. I'm now conscious enough to recognize and to make a choice to try to step out of it. And from there, then people can come together. It doesn't always work, because sometimes when the other person is so triggered, they're now unhappy that because you're stepping away might be another trigger, right?
An abandonment thing.
Of having their loved ones pull away and disconnect. And so even though you're being loving and respectful, it can still be triggering. You know, in my 35 years of practice, it's so interesting to look back and to see what are the traumas that people are carrying from their past that are creating the fear and anxiety now. And one of the things, it's kind of an interesting one. I know you know about this, but probably our listeners don't know a lot about it. But there's a condition or a thing called the vanished twin syndrome. Right. And not a lot of people know about it, but everybody I've ever had a conversation with about this, they're fascinated by it. So it turns out that a certain percentage of pregnancies, I think it's, 10 or 50%, I got to get that number down, actually begin as twins. And then at some point, very early on in the pregnancy, one of those twins dies. And in most cases, that tissue is just reabsorbed. Or expelled, or in very rare cases, it's absorbed by the surviving twin. So what we now understand is that surviving twin, on a very deep emotional and primitive emotional level, has experienced the death of that twin.
Yeah.
And they come into this world having already been traumatized by that.
Yeah.
And, that's something we can now talk about. 35 years ago, we couldn't. Now we're starting to understand. So I had a patient who came to see me, and we had done chiropractic and nutrition. And I said to her, we've never worked doing any emotional clearing. Are there any issues or patterns in your life that you might want to address? I'm happy to help. And she said, well, actually, I'm a little anxious and afraid all the time. And I never would have guessed. And she said, yeah, all the time, like that low level buzz of anxiety
in the background. Yeah.
Something bad to happen. And I said, well, let's figure out what it is. So we did the emotional clearing process, and we discovered that, in fact, she had a vanished twin. So she literally was born with these emotional imprints from that loss. And that she just, here she was, a woman in her 30s, finally recognizing, I'm afraid all the time. Now, we did the emotional clearing, and it was one of those miraculous situations where the fear just kind of dropped away.
Right.
It doesn't always work. It doesn't always happen that way. Very often, you and I both know that
right.
very often people have, a trauma at age 3, a trauma at age 7, another one at age 9.
Yeah.
And they're sitting there like little individual emotional buttons, but they build and accumulate. And now, as an adult, you might be in that state where you either get triggered as an episode of being triggered, fear, anxiety that comes and goes, or it starts to become recurrent, and life is so stressful that those buttons are getting pushed all the time, and you could still be in a state of chronic anxiety.
Yeah, it's fascinating. I have a colleague who used the analogy of an electric panel. Her husband was an electrician. She was talking about how the triggers blow, it's like blowing a fuse, and you have to go reset the circuit breaker. And some people just have a few buttons on that panel, and some people have a lot. And that's where the astrology piece comes in kind of a magnificent way, because it shows us what we were thinking, or what we and the organizing forces of the universe were thinking and intending when we dropped in, when we incarnated or reincarnated. And all the different signs have an indicator for emotional, like what's your emotional asset and what's your emotional liability. Like the sign of Cancer, your emotions are you're very emotionally articulate. You're very emotionally aware and in tune with your emotions. But on a bad day, you're very emotional. Like it's hard to control or manage emotion. And there's a lot of fear and anxiety a lot of times with people with a lot of cancer, or something in cancer that's afflicted or negatively aspected. And so it's a real helpful shortcut for me when I'm working with people. It shows me where to look, and then it helps me make the lists that I give them to send to you. It's like, have double check this. I'm sure there's other things, but this is what I can see. This is what I can see. Yeah.
And for me, the value of being able to send someone to you and to get that overview and to get those, it's like having those tendencies is such a gift to know, what it looks like when you're in balance, what it looks like when you're out of balance. Because every astrology, my understanding is that, as you say, with each sign, there are going to be certain tendencies, but it doesn't mean you're doomed to that.
No.
Yes, you're always going to lead in that direction, but you can find that balance. It's just it's such a wonderful tool to use and to have. I think that one of the things we were going to talk about, and I don't want to miss talking about this piece, was we get so excited,
we do.
we have our outline, but we go all over the place with it.
Yeah.
But you and I were talking a lot about the people who are considered to be sensitive.
Empaths.
Yes. You and I, for our generation, it was always considered a weakness. And you would say to someone, oh, stop being so sensitive, or you're too sensitive. Right.
Right.
And in fact, I believe, as you do as well, that being sensitive is actually a tremendous gift if you can manage it and navigate with it. So we talk about the canary in the mine. The miners went down into the mine, and they would always have a canary in a cage, because the canary was very sensitive to the poisonous gas that might come out through the mining process. And if the canary dies, then the miners need to get out. So the truth is, the canary in the mine, the sensitive one,
the bellwether, yeah,
the bellwether, they're aware before we're aware, but we're all being affected by the same thing. So the gift of being sensitive is that you are aware before the rest of the population. And if you can learn, to develop your awareness of your sensitivity and how to manage it and how to have really healthy boundaries around yourself. And then, somewhere in whenever that book came out, The Highly Sensitive Person,
right.
For the first time, this woman, Elaine Aron, wrote this book about the highly sensitive person. All these people felt so validated.
Liberated.
Yeah.
Could be. Yeah.
So prone to fear and anxiety, to being so affected by what's going on around them. And of course, the last 2 years have magnified going on around people. And I believe that a lot of my patients, a lot of your clients, who are exhausted or depressed or afraid, are literally being affected by what's going on around them.
And this is huge. I can't stress this enough. One of the things that absolutely blew my mind when I was coming out of the closet as a psychic and learning how normal it was, and then learning what to do with it, with my intuition, was the fact that everybody has the sixth sense somehow, somewhere, whether it's auditory or kinesthetic or visual or something else, everybody has it. And you don't have to cultivate it to the level of being a working psychic to live more integrated into your life, so that it brings you more peace and confidence and success. And so there's that piece. And then that gets really fun and funny when I'm training students. It's like, hey, look what you know. And then the joke is, it's not hard to get the information. It's hard to be present with what you get. So that's like the biggest piece with students. But that was what was blowing up my phone in the first 6 months of COVID and the lockdown in California, was because people were suddenly realizing, I'm feeling fear. I am feeling fear like I have never felt fear before. I can't sleep. I'm anxious. And finally, one gal who's tends to sit in the front of the room, she's one of my Aquarians. They're always like first to figure it out. And she was just like, is this the collective unconscious? This isn't just me. I'm feeling my neighbor's fear. I'm feeling the fear in my neighborhood. I'm feeling the fear of people dying in the hospital. I'm feeling the fear and the uncomfortable emotions of people losing people that they love, or people wrangling with how to hold COVID intellectually, politically, familially. How do I keep my family safe? Do I want to try? Because some people don't believe it's necessary, but like, there was this explosion in anxiety in the first 6 months of COVID, because people were feeling more than ever. And then people were realizing how interconnected our souls are and how powerful the oversoul is, as Emerson said, the collective unconscious, and that we are a lot more connected than we realized. And so then it's like, soothe that little hippocampus, let's shut the throttle down and let's, okay, good. You realize now how the world is a much deeper place, and let's calm that down for you, so then it can become a tool for you rather than a punishment or a victimization or a liability.
Exactly. And I know we want to get into, we're coming down to the last 10 minutes, and we want to get into offering people a lot of different opportunities to help, good advice, but also that whole idea of the highly sensitive person. Now, in the last maybe 10 years, the term being empathic or being an empath has become more, like we always used to say, this is a common thing to say when somebody's died, oh, you have my deepest empathy, meaning feeling for you. And I've always said to my patients when we deal with this, people who are the oversensitive or over empathic type, is that it's one thing for me to be with you, let's say, and you tell me your story and I'm moved by it. I might even be moved to tears, but it doesn't affect me in a negative way. So the difference between being able to be empathetic and over empathetic, or sensitive and over sympathetic, is that you can take that, you can be around other people and have, a communion with them without having it affect you in a negative way. That's the healthiest way to be. And those who are, again, it's finding that balance. It's finding that way to integrate that gift and make it an asset rather than a liability.
And also a piece of that has to do with practicing extreme, exquisite self-care, because everybody, and it's not just a day at the spa, though that's awesome. It's a lot of grounding techniques, breathing techniques, prayer, meditation, exercise, diet, nutrition, and supplements. It's keeping your vessel powerful. Right.
When we now know, it's been clear. I mean, those of us in the field for all these years have known it, and now it's been documented that lifestyle, like what your genetics are, that's the poker hand you got dealt at birth, is the way I think.
Right.
Yeah, you're born, you get dealt your poker hand. You've either got a full house and lucky you got great genetics and you can really screw up and still be okay.
Right.
But if the genetics is only one piece of the puzzle, and most of what either will wake up those genetics or not is lifestyle. So lifestyle really is the key to health and well-being. So that has to do with nutritious food, all the things you mentioned, meditation, exercise, exquisite self-care. And especially for the sensitive people, the ones who tend to be highly sensitive or empathic, all of the change and the intensity of the change and the speed of the change over the last 2 years has really destabilized these people. And so for them, one of the things that they can do that's really important and stabilizing is to implement routine.
Right.
The more routine, at this time of day I do this, at this time of day I do that, I eat this food, I take this supplement. The more routine you can implement in your life, especially if you are one of those sensitive, empathic, difficult with change people, is to implement more routine. The other thing I think that's so important that isn't a standard medical practice yet and should be, is that everybody should be getting their vitamin D levels tested, because a healthy immune system requires a healthy level of vitamin D to function well. And I'm saying to people out there, if your doctor doesn't routinely check you for that, please ask for that. You have the right to for that. And if it becomes routine, we have to take responsibility for that.
Right.
And of course, we want to encourage people to reach out for professional help if they need it. Reach out for therapy. Reach out for whatever you feel you need. Now, for Beth and I, we are professionals and we are here to help. And Beth, we want to remind people of the symptoms that might be telling you that you might need help: sleeplessness, exhaustion, depression, self-medicating, alcohol, drugs, food, gambling, addictive behaviors,
weeping
on medication. You're thinking about taking more medication. Those are clues that you might need to reach out for help. So for your practice, what are the kind of people that right now, especially, what kind of people do you want to help?
Well, what's really interesting to me is I have a teacher in my practice that I've worked with on and off since 1999 or 2000. And so she sent me an email the other day and she just said, I'm noticing I'm a little more irritable with people. Teachers are so kind, they're so gracious. And in that gracious way, she's like, I'm a little more cranky. I'm a little more irritable, And then another gal is like, I'm weeping at a drop of a hat and I'm not pregnant and I'm not menopausal. So there's no earthly reason for this. And I need to get at the core of it. I have another woman who, she works in one of those customer care call centers. It's just like a cubicle farm. And she was just like, I'm working overtime a lot and I like being at work. I don't like to be alone. She's single, no partner, no she's a grandma now. She's got kids and grandkids, but she lives by herself. And she's like, I'm having a really hard time being alone. I'm having and or again, sleeplessness. That's one of the things I'm hearing the most, where people are having a hard time. They may be very tired, but your head hits the pillow, and after about 7 minutes, your eyes are just wide open, and you're worrying or stressing or running your tape loops, whatever those are.
Well, Beth, I want to take these last few minutes to give people information so they can. You have a website and you have a page. Both are called Beth McDonald Consulting.
Yes.
And they can find our first podcast that we did, Mental Health in the Time of COVID, on grief and loss and missing out. They can find it on your website or podcast. Website or
Facebook
page, Beth McDonald Consulting. For me, they can find it at my YouTube channel, Emotional Clearinghouse. Now, we are in a series here.
Yes.
We will announce fairly soon what, probably the second week in April, we're going to do the next Mental Health in the Time of COVID podcast. And it's going to be on anger and depression. And then we will follow it up later with another one on grief, because we're going to take even a deeper dive into grief, because it's so prevalent, and it is probably the most misunderstood emotion, as you have told me.
Yes.
And then I also want to let people know I'm very excited for the first time ever to be offering, a membership in the Emotional Clearinghouse. So my online emotional clearing programs at the emotionalclearinghouse.com. We now have a membership, and for $47 a month, you can join. And when you join, we will give you a gift of a free 3-part emotional clearing program. We have 4 available. One is on healthy, happy relationships. The next one is on fear and anxiety. The third one is on body image and weight. And the fourth one is on money and wealth. That will be our gift to you. And then every month, you will be given a new emotional clearing session that you can use as many times as you want. They're designed to be repeated. Every time you repeat an emotional clearing program, you can go deeper and deeper and access different levels of stored emotional trauma. This first one that's available is on grief and loss and missing out. And the second one coming up next month will be on fear and anxiety. So they will follow these podcasts, at least till we're done with our series. So anyway, everyone, my website is emotionalclearinghouse.com. Beth is at Beth McDonald Consulting. And Beth, as always, I love conversations with you. I love sharing them with people. And I want to say thank you and farewell to our listeners today. And we'll see you next time. Take care, everyone. Bye-bye.
Thank you.